This is the last lecture of Unit 1 for Exercise Science 219, Digestive Disorders. So the ultimate goal of this particular lecture is to explain how diet relates to each of these disease processes. If you are going into a health professional related field such as nursing, sometimes psychology, exercise science, you'll likely learn a lot more about these disease processes in relation to their pathophysiology or biology in the body. Even though my lecture gives a short description of that disease process, the purpose really is for you to understand how diet relates to that disease process and what dietary recommendations can be made in order to improve some of the symptoms or the disease process itself. So just keep that in mind as you're moving forward and studying with this lecture, is that your focus is diet in relation to the disease process. So the first disease process is constipation. Now the definition of that is less than 3 bowel movements per week. Now I'd like to point out that constipation is typically thought of as a symptom, not a disease process. And it's actually caused by a slow transit time of food through the digestive tract. It's usually caused by a poor diet, but it can also be a result of taking supplementation, particularly multivitamins sometimes with a high iron content. Calcium and iron also have the tendency to cause constipation. A lot of medications, prescription medications specifically, sometimes pain medicines, also can cause constipation. But normally we're talking about a diet that is low in fiber, low in fruits and vegetables, sometimes low water intake, high in sugar. So treating it is a lot of times diet related. They typically don't want to use medications first. And the reason that is because your body can actually become reliant upon laxatives and things such as Miralax and a lot of fiber supplementation. Your body will begin to expect those supplements and those medications, and it almost causes the gut to become a little lazy. So ultimately, the first line of treatment should be through an adequate intake of fiber, which is about 25 to 30 grams of fiber daily. It depends on male or female, male being on that little higher side of that fiber. In order to do that, we need to what? Increase whole grains, increase fruits and vegetables. It's really important to note, though, that we should gradually increase fiber, and that water intake should also be increased because of the way that fiber breaks down in our gut. Going from only taking in 5 to 10 milligrams or grams of fiber daily to immediately doing 30 will cause the opposite effect, and someone might actually have diarrhea or extreme GI distress. So remembering that high fiber foods, we're talking about beans and legumes, those whole grain products, fruits, vegetables, nuts, and seeds. So for peptic ulcers, what that actually is a sore almost on the stomach, or typically in the upper part of the small intestine, the duodenum. It can be a lot of different things, but typically what we see is this bacterial infection called Helicobacter pylori, or often called H. pylori. It can also be caused by an excessive use of aspirin or over-the-counter pain medications, as well as just a lot of acid production in the stomach, or that's dripping too much down into the small intestine. Ultimately, what's happening is the intestine has that protective mucosal lining, and there is a breakdown of that lining. So then you have this very acidic environment that actually starts to erode the muscle in the intestine. And what that causes is extreme pain. A lot of times people aren't able to eat. They feel nauseous, they feel sick after eating, and then ultimately they have weight loss. So you can see here that it literally looks like a sore on the gut, very painful. So ultimately, if the problem is that it is an H. pylori bacteria, we have to give antibiotics to get rid of that bacteria. But another thing that can be done is drugs to reduce stomach acid. So we're talking about Pepsid AC, Nexium, things like that, that actually go in and tell the stomach parietal cells to not produce any acid, to kind of decrease that acidic environment that's eroding it. So heartburn. Heartburn is typically described as a gnawing pain in the upper chest, and heartburn, once again, is also typically thought of as a symptom, where the disease process of chronic heartburn is actually called gastroesophageal reflux disease, or you'll hear it referred to as GERD. So when you're thinking about the anatomy of the stomach, we have the esophageal sphincter at the top of the stomach that connects the esophagus and the stomach. And how we've talked about in class, that sphincter typically keeps that stomach acid from eroding upward or kind of regurgitating up into the esophagus if it works well. If it does not work well, that muscle actually becomes relaxed and you will have those acidic juices start to go up into the esophagus. The esophageal lining is not made like the stomach to have that acidic of an environment, and so the lining becomes inflamed and painful. So there are many diets or foods that increase heartburn. So if somebody's experiencing the symptom of heartburn, a lot of times we recommend not to overeat. A lot of times with the obese population, we see GERD and heartburn happening just because of an overeating or a portion size. High-fat foods also have a tendency to create heartburn. Carbonated beverages, alcohol, spicy foods, tomato sauce. Actually, an inadequate fiber intake can go hand in hand with heartburn, coffee, and also mint flavorings. So similar to the constipation, the first line of treatment for heartburn or GERD is lifestyle changes. We want smaller meals. We can recommend less fat if fat tends to be something that causes it. Smoking can actually increase heartburn. So if they're a smoker, we want them to stop smoking. One thing we can also tell them to do is remain elevated after eating. Typically, that's a 45-degree angle. So don't lay down. When you lay down, that acidic environment's naturally going to erode up. Avoid those trigger foods. So have them maybe make a food diary of foods that are triggering it, and have them just avoid those foods. Also, they can take over-the-counter antioxidants, such as Tums, but the problem with that can be sometimes when people overuse those, they can actually create constipation. So if people are taking them several times a day, we may want to talk about doing some more diet changes or ultimately some medicine if these diet changes do not work. So diarrhea, the actual definition of diarrhea is increased frequency, fluidity, or amount of bowel movement. And so what you're actually typically talking about is 3 or more liquid stools in a 24-hour period. Typically caused by bacteria and viruses. And what's actually happening is the intestinal cells are secreting additional fluid. And then the contents are just moving way too quickly through for the water or any nutrients to be absorbed. So we typically see diarrhea in developed countries as a result of potentially foodborne illness. But it is still a major issue in developing countries on that bacterial viral side from contaminated water or contaminated food products. Can also be related to medications, similar to constipation. The treatment is we want to increase fluid. So they have the tendency to become dehydrated, and we also want to avoid sugary drinks. Sugar actually causes further leaching of the water and fluids from the intestinal cells and will cause more fluids to be excreted. So we definitely want to avoid sugary drinks at all costs. A lot of times we talk about Pedialyte as being a good option. We just want to watch the sugar content in that because we're also replacing electrolytes, but we don't want to have too much sugar. Irritable bowel syndrome is just defined as irritable bowel function. It's actually really difficult to define because symptoms vary from person to person. We don't really know what causes irritable bowel syndrome. It tends to be different for different people. We typically categorize this as a group of diseases that could be characterized by cramps, gassiness, bloating, irregular bowel function, such as diarrhea or constipation, and this has to be on the chronic side of it. So this has to occur for 3 or more months in order to be considered a disease process. So because we don't really know what causes it, we don't have a cure, but we can treat the symptoms. And the most important thing to take away from this is very individualized treatment. Because it does vary from person to person, what actually causes the problem or what symptoms are present is what's actually treated for that person in particular. So if we think caffeine is triggering it, after looking at a food log, we restrict caffeine intake. We often recommend lower fat, smaller meals. Sometimes we see IBS with patients that have depression or anxiety. So a lot of times we're talking about stress reduction or even a medication for the depression and anxiety. Probiotics to keep that gut healthy, a good fiber intake. Flatulence is also known as gas. Like to note that it's a normal body process, and it's just the presence of excess gas in the stomach and the intestines. Interesting fact, your body actually produces 1 to 4 pints of gas per day. Now, we can see an increase in flatulence due to the ingestion of fructose or fruit sugar, a lot of air being swallowed with food or beverage, or sometimes we see it with bacterial production from food products. Some other definitions to be aware of: colitis, because your colon is your large intestine. Colitis simply means an inflamed large intestine. A lot of times with this, we're talking about needing just a bowel rest, so simple foods, liquid foods, and they have to treat with medication. It is a chronic disease process that they can often see bouts of inflammatory process. Celiac disease is another important thing to note. It is actually an autoimmune disease, meaning your body just starts attacking itself. We see an inflamed small intestine related to the consumption of gluten products. So gluten is the protein that actually holds together bread that's activated when you add water to flour. And so celiac disease is the only real reason to take in a gluten-free diet, because of the fact that their body is literally having an allergic reaction to gluten. So we want to totally avoid gluten so that the body can absorb and digest the nutrients that you're providing it, because what ends up happening with that inflamed small intestine is your villi and your microvilli in the small intestine that grab those nutrients actually start to lay flat with no absorption happening. So we want them to stop eating gluten so that their small intestine can become repaired. Soluble fiber, just a difference here. Soluble fiber, remember, dissolves in water, as the name suggests, and kind of forms like a viscous gel. This is the fiber that we see with a decrease in blood cholesterol, and we often find it in whole grain products such as barley, oats. We see it in beans and legumes, prunes, figs, and sweet potatoes. On the other hand, sorry, this is so blurry here, we have insoluble fiber, which aids in motility and prevents constipation. So it doesn't actually dissolve and become a gel. It basically just kind of pulls together what's in the large intestine and keeps things moving through the GI tract. Very similar products. We're talking about whole grains, beans, fruits and vegetables, and leafy green vegetables. And that is the conclusion of this lecture.